Assalamu alaikum, everyone. I'm Miriam, Regional Ambassador for the Islamic Medical Association of North America, and I would like to welcome all of you to our webinar on mental health stigma, navigating awareness, acceptance, and access. We have with us today Dr. Amber Khan, who is the chair of the IMANA Education Committee, and she will be joining us shortly, inshallah. And our guest speaker is Dr. Farha Abbasi. Dr. Farha Abbasi is an assistant professor in the Department of Psychiatry at Michigan State University and staff psychiatrist. She immigrated from Pakistan and settled in the United States in 2000. Her areas of interest are cultural psychiatry and teaching medical students how to provide culturally appropriate care to Muslim patients. She works with the Muslim American community to encourage integration rather than isolation from mainstream society. She has established the Muslim Mental Health Conference and is the managing editor for the Journal of Muslim Mental Health. We're so happy to have you here with us today, Dr. Abbasi. And without further ado, I invite you to begin your presentation, please.
Thank you. First of all, I would like to thank IMANA for inviting me and giving me this platform. Your organization is doing such impressive work, is serving community in so many ways that I have always been really appreciative of that and have always tried to partner and collaborate with you. So today I want to focus on stigma. And to start with that, we see that around our mental illnesses, people kind of don't differentiate between mental health and mental illnesses. And what happens is there's so much shame around it that then instead of accessing care, they kind of are just sitting in silence, and then we see them in crisis mode or with very bad untoward consequences. So first of all, I think there's three ways I always try and approach this work. I want to create more awareness around what is mental health and what is mental illnesses, create more acceptance, and then improve access to timely care. So going with the first part of it, the awareness. So like physical health, we also have mental wellness and well-being. That is when you are functioning on your optimum ability. And that doesn't mean that you are not feeling sad sometimes, or you are not feeling anxious sometimes, or that bad things are not happening around you, but that you have the capability to come back from all these stressful situations and cope it in a way that it does not affect your mental health. Because what happens is when we don't take care of our mental health, it invariably affects our physical health as well. So it's very important to understand that concept first. And when we talk about mental health awareness, I think it is so important, like on physical health issues, how we think in preventive terms of how we can avoid being sick, right? Avoid falling sick. We should start thinking in those terms when it comes to mental health as well. So there are things that you can do to augment your mental wellness. And there definitely, like physical health issues, there is a chance that you might develop depression, anxiety, or severe conditions like bipolar or schizophrenia if you have genetic predilection or vulnerability. But if you have good mental health and wellness, the chances are that the severity would be less or symptomatology would be lessened. So that's said and done. What does then it means to be mentally ill? So mental illnesses are health conditions that change your thinking, your emotion, and behavior. So imagine when you are not feeling well, when you are feeling sad, it impacts your behavior. So there are chances that instead of indulging in healthy behaviors like eating healthy, exercising, connecting to family and friends, you tend to isolate. You tend to maybe sleep less or more, eat less or more. Or in severe cases, if you are not coping well, then you can go towards substance abuse. So these, how we assess these mental illness, they also fall on a spectrum, right? It can be mild, like situational conditions, or they can get moderately serious, like major depressive disorder, recurrent, or they can get very severe, like bipolar, or really like more severity, like schizophrenia. But what we know now is that early diagnosis and intervention still can improve your chances of living close or approximately close to your optimum functioning. So it's very important to have early diagnosis and early treatment. But how do we assess the severity of mental illness? When we see it's impacting our functioning, and it can express in ways like it can affect your social interactions, it can affect your academic work, it can affect your job situation. So when it starts to impact your functionality, and then, God forbid, if it gets to a point that you get to a point of isolation and severe depression, that you start thinking of yourself as worthless, as a burden, then you start to get thoughts of hurting yourself or hurting someone else. So these are like a spectrum again, and we have to approach it like we do with any physical illness. So roughly 1 in 5 adults in the US, and this is before COVID-19, right? Right now, we don't know. It can be 1 in 4, or if we see the sequelae of mental illnesses, that's going to hit us more as the COVID-19 pandemic prolongs. It can be 1 in 3, especially in youth. So roughly 43.8 million are experiencing mental illness in a given year. And it's costing America $193 billion. When you put a dollar price on it, then also it has become the major cause of disability. And it's going to be leading cause of disability in the world. But what happens in our communities? I love this slide. I've been using it since my first presentation 15 years ago, and it's getting very bad, but I loved it because it shows you that we tend to hide things. We tend to keep things under shame, silence. But what happens when you don't talk about things, when you try and hide things, this is where stigma comes in, and this is where your shame and silence, they all go hand in hand. But what we see, that the problem is not going to go away. Even if you hide it, if you try and not deal with it, it's not going to go away. It actually gets bigger and bigger. So we know that right now, worldwide, not only in our community or culture, worldwide, stigma is the biggest barrier in access of mental health. And so we really need to understand what is this stigma and how it impacts our communities. So what is stigma? Literal definition of stigma is a mark of disgrace, right? It can be something happened, or it can be a character, or it can be about a person. But what happens with mental illnesses? It's a health crisis. It's a health issue. What happens if you have diabetes, or God forbid, if you have been diagnosed with cancer? Everybody feels like, oh my God, they are sick. But when you are feeling depressed, anxious, because it's not tangible, it's not apparent, you don't have a fractured bone, or you are not limping, people will say, it's all in your mind. It's not real. And that's why the stigma comes in, that this is not illness then. Then if you cannot see it, then maybe you can control it. You can think it away. You can pray it away. You can do something about it. And that's where the stigma comes in. This is the trio, right? Shame, silence, stigma. Right now, I have started a whole movement around visibility is viability. Because unless things become visible, you don't understand that it's a problem, and you will never access care for it, right? So if you want to survive, be healthy, like if you have pain, or you are limping, or you feel short of breath, you immediately think like, oh, I should get it checked, right? So when you are getting depressed, and there's a difference, right? what is physiology and what is pathology, right? So we have vague pains when we wake up, but we don't rush to the physician for every pain or ache. But when it starts to affect our functioning, you feel like, no, this is no more just a regular thing, and that there's something going wrong. So take an example, like right now, you and I are breathing, but we are not aware of it. If we start becoming aware of it, that's pathology. Same way, your heart is beating right now, but we are not aware of it. But as soon as you become aware of your heart beating, then that's a pathology. Same way, sadness in itself might not be a big issue. People will say, what's the big deal if I'm feeling sad or anxious? It is when it becomes problematic. Instead of it going away, it's lingering. Instead of you functioning to your optimum ability, you are not able to keep up with relationships, work, assignments. So that's where it's important to understand. But if you are gonna feel like, oh, this is something in my control, is it real? I must be a bad person to feel this way. There comes shame. And anything that makes you shameful, you will try and hide it. And that's where the stigma deepens. And of course, we have our own perception of the diseases, right? We have our own disease models, especially when it comes to mental illnesses. We feel like, is it like we are not praying enough? We have lost our faith, and you will see your parents or extended family might say, hey, you're not, how can you be depressed? You have everything in the world. You should have seen our lives when we were growing up, we had nothing. Or when we came to this country, we had nothing. We had to work so hard. That is the perspective around the disease model, right, that we have for mental illnesses. And again, the other thing is evil eye, right? Or maybe it's jinn possession. It is anything but the disease. And what's the reality? This is where I'd say we need to have acceptance that this is not just an illness happening out there, that we being Muslim, or we are coming from this great community, or we come from this culture, protective culture, that we will never be depressed, anxious, or need to use substances or indulge in any behavior that can be detrimental to our health. What is the reality? There is higher rate of depression in second-generation immigrants. Deep stigma, lack of awareness, limited access to care all play a significant role. Research already is showing that on one hand, we are already very vulnerable as immigrants, or even if you're born in this country right now, being Muslim in itself is a big vulnerability. We have so much Islamophobia around us, or bullying around us, or threats of violence around us, that already we are very vulnerable to this trauma. And then some of us who are immigrants have double jeopardy kind of situation. On one hand, we have more vulnerability, but on the other hand, what we are seeing, that the minorities do not access mental health care in a timely fashion. And of course, stigma is one important reason, but the other reason is not having the awareness or not having the resources. We have a major South Asian community around us. So imagine our youth, 15 to 24, are more likely to exhibit depressive symptoms. Higher rate of suicide among young South Asian American women. I want to repeat this. This is higher rate right now of suicide attempts or completed amongst young South Asian American women. That is why this is so important, that we start to have these conversations, open up these conversations, take away this shame around mental illnesses. And yet South Asians, again, have the lowest rate of utilization of mental health services. I would let that sink in. This is the thing basically where all the advocacy work right now is focused on. So when we say it's all in your mind that you're feeling sad, but what happens when you're feeling sad and anxious? Your whole body, there is like stress hormone being released in your body, cortisols, and there is chemicals being released in your body that not only changes your brain structure, but it affects your heart, it affects your whole body structure is changed. So think of it this way. 4 leading causes of death. You can say cancer, diabetes, cardiac risk, smoking, all these. What's the biggest thing? Underlying common thing? Stress, depression. So even if you take physical health challenges, unless you take care of your depression and anxiety and mental well-being, you will have very worse, severe outcomes like diabetes, cancer, smoking behaviors. So this is why it is important to remember that minority status, experiences of prejudice at social and economic disadvantages, communication barriers, this does have a huge impact on your mental health, and you're facing these burdens every day of your life. On the other hand, what we see, we have denial, we have avoidance, we have unhealthy coping mechanism, So one thing, please don't underestimate that we don't have substance abuse in the community. Everything that's happening out there in the society is happening in our communities as well. It can lead to unemployment, homelessness, or worst case scenario, incarceration. So the World Health Organization has predicted by 2020, and this was before COVID-19, right? That depression will be the second most frequent cause of disability. So this has changed. It would be one of the leading causes. Second only to ischemic heart disease. So really the numbers have not come out, but we were already on verge of an abyss when it came to mental illnesses. And this COVID-19 is a big risk factor for your mental health. So we are expecting a big tsunami of mental illnesses that's going to follow. Already is unfolding, but it's going to follow more. If we put this 1 in 4 right now, people who are suffering from mental illnesses, then apply that to all of us too, right? So roughly 1% population of America identifies as Muslim, 13% are under age of 15. So we have very vulnerable, we are almost 20 years younger than other religious communities or minorities in the country. 10 to 15% Muslims suffer from clinical depression, and 60,000 by a rough estimate are suffering from psychotic illnesses. And what we are seeing that now that we have so many, if you look at the world scenario, 40 major conflicts are directly happening in Muslim countries or impacting Muslims. So you have a lot of people in exile, you have a lot of people dealing with the refugee status. And what we are seeing, that more the trauma, more chances that you will break away from reality. Your brain can take the trauma, and after a while it just disconnects from reality. And that is what we are seeing, increase in psychotic illnesses. These numbers are pretty eye-openers. 25% of American Muslim college students have used an illicit drug, marijuana, cocaine, or heroin in the last year. So we do have opiate epidemic in the community. You do have meth abuse happening, cocaine. So all that is around us, be it mental illnesses and substance abuse, societal ideations and behavior, or completed suicide. These do not discriminate on basis of religion, communities, vulnerability. In fact, the more vulnerable you are, the more the chances of this happening. So 1 in 4 Muslim students reported that they often or always are experiencing stress at school, while 3 in 4 students describe having been really stressed out. And these are old numbers, right? That was so bad then. Can you imagine what is happening in the last few years? Islamophobic incidences have quadrupled, bullying cases. So Muslim kids have almost twice or thrice higher rates of bullying than national average. So we are seeing Muslim kids are reporting feeling disillusioned, angry, and 75% are saying they know of someone who has been discriminated against. And these numbers are really on the rise, actually. So we do have positive qualities in our community, in our infrastructure. Muslim families are very close-knit. We have extended families, which can be a blessing or can be, again, a source of stress if you don't have very structured boundaries and respect each other's privacy and support each other unconditionally. Because one thing we see is one of the reasons the stigma deepens is that we become very judgmental of each other instead of supporting each other. Again, another thing is our faith is our big source of resilience and healing. But at times when you are going through depression, anxiety, or any struggle in life, the first thing that you question is your faith. Depression, mental illnesses can lead to spiritual struggles. And at the same time, if for any reason you don't feel that connection to God, or you are having struggling with your religious identity, that can itself lead to depression and anxiety. But let's say even if you are somebody who prays religiously and does everything right, and when they are hit by clinical depression or something, then that is, to them, is very devastating. That, has God given up on me? Is God punishing me? Am I being tested? And I know one thing we talk about, a concept in Islam, which is to persevere, and it is taken as passive. So I was just reading, B.R.E.A.T.H.E just wrote this piece today on Facebook, and it's just so impressive that in Islam, nothing is passive. When you talk about submission, it's not a passive act of just giving up. It is very active with will and consciousness. You are submitting. So it's a verb, you're submitting. Same way, patience and sabr is a very active form of ibadah, where you believe that in the end, God is either testing you or going to give you relief. But that doesn't mean that God didn't tell you that this means you just sit in silence and not take care of yourself or not access treatment. It's a very active form of willing to submit to the will of God, right? It's a very active ibadah. It's not passive, and it's not just giving up. It is, you continue to do everything, because in Islam, and I will come to it, your wellness is extremely integral to your religious practices. And this is the slide I was talking about. This was such an eye-opener for me, this slide. When you look at Maqasid al-Sharia, preserving your deen, your nafs, but what is very important, preservation of your intellect. It is one of the basic tenets and rules that you have to do everything to preserve your intellect. And by preserving your intellect, what is it about? Mental wellness, that you have to take care of your mental health as much as your physical health. So we know that even when prophets would get sad or would start questioning his life or anything, he would go and meditate. He would take care of his wellness. He would take time away from his public responsibility and would go and meditate and sit in silence and pray. So giving his mind, his brain a break. Another thing, really, if you look at the practice of Islam, unless you are mentally competent, you can be Muslim because you are born, but to be a practicing Muslim, you have to think you are Muslim, you have to believe you are Muslim, you have to say you are a Muslim, so Shahada, and then you have to act on being a Muslim. So unless you're mentally competent and don't understand that you are willingly submitting, you can't be a practicing Muslim. So that's why mental wellness is so integral. And interestingly, if we look at the history of psychiatry, it all started with Muslim scholars, psychology, as mental health asylums, and we can trace the diagnosis and in some of the old historical books that OCD was described long time ago, depression was described. And even if you read the Quran Sharif and understand that it's so much in every sentence or every few ayahs, it's saying, don't lose heart, don't huzn. So in Arabic, you have words that describe depression. On the other hand, the majnoon, So if you are not mentally competent, you were exempted. You were exempted from your religious duty, your social duties, your societal duties. And in fact, the society had to take care of you. So it is very important that we understand that mental illnesses is not just a Western concept. It's not a byproduct of living in a Western society. It is very much, has always been there. It is about our wellness and well-being. And of course, given this model, the belief system that we have, how are we accessing care? You can see that where is the mental health services coming in is in a way like almost a mental health provider only comes in when it's a crisis moment, right? When we are facing something severe is happening. So people usually like to go to their family members, then faith leaders. Then you might end up in a family care clinic with vague pains and a lot of somatization. But until unless you are in a crisis, you don't usually seek mental health. So I talked about it again, that if we take away being judgmental from our community, or being this in the Islamic centers, thinking like, oh, you are a good Muslim, you're a bad Muslim, you are not good enough. If we take that away, then these are all huge resources that can be employed and applied to your mental wellness and well-being. Because people do first go to their imams more than coming to a provider. So this is where our work, the collaboration with the imams started happening, because I think it's an ideal model given, and this applies to all the minority communities, especially religious communities, that we can be really good partners with the faith leaders. But in order for that to happen, the faith leaders have to be trained in first aid mental health or have some kind of training in mental health. It doesn't mean they're going to become therapists or start diagnosing, but I can give you a good example. Like I work very closely with the East Lansing Islamic Center, and we cross-refer to each other all the time. So I can give you an example. I was working with a college student who was really struggling with his religious identity and was severely depressed as well. So I treated the depression, but then I brought in the imam to have a conversation with this kid and dispel his concerns. On the other hand, recently we had a kid going through psychotic breakdown in Ramadan who thought he was having spiritual experiences. And he was taken to the imam first. And imam, because he had been trained in the first aid mental health training, was able to identify psychosis. So he said, yes, I will pray with you, but I really want you to connect to a psychiatrist as well. So it's a win-win situation. I think the most important thing we had to establish was the clear boundaries, that I might be a practicing Muslim, but I cannot be a preacher or an imam. I can talk about my understanding of Islam, but I cannot be the final word on it. So once that is clear, the boundaries are clear. At the same time, imam might be able to identify psychosis or depression, but they are not going to be mental health provider. But we as together, we can really augment the wellness and can really come up with really healthy solutions to navigate mental health. Community, community, community. Extremely important that we need to educate the community elders, the Desi aunties. I love to talk about them. I'm called the anti-Desi auntie. I think we in Islam, when we were told to be in community, we understand, if you look at the society right now, isolation and seclusion has become the biggest epidemic in Western societies and in fact in our countries as well. So what is happening is being in community is a big source of resilience for your health. Connecting to people, talking to people, sharing your pain with others, it's a big help. So even in suicide prevention, the first thing we teach the patients is not to isolate. But what happens is if you are going to be judged, or if you feel ashamed of opening up or talking about what is really bothering you, if you don't become that safe spaces, then we are ensuring that people will go and may indulge in unhealthy behaviors. So it's a very important initiative that community leaders should be identifying. I also have been working on projects where peer support groups has to be developed. And it's invaluable if somebody from your own community, faith, or your cultural background kind of validates you and say, it's okay, it's fine, things are gonna settle down, nothing wrong with you. It's a huge burden of somebody suffering from these situations. So it is extremely important that we work in the community. This is the model, like I said, that psychiatrists can evaluate, give diagnosis, give medications. We can bring in culturally trained therapists that can continue supportive therapy. And then, of course, you can continue praying with your faith leader. All these is three pillars that I see coming together and can really provide a good structure around you. And then, of course, family and friends, community, huge importance. We tell everyone that life is gonna happen. You will get stressed, and as you go forward in life, go from undergrad to college to professional schools to marriages to relationships, careers, it's like you're climbing a mountain. And then once you reach the top, then it's like, oh, then you start worrying about your kids reaching it. So it's never end. Life will continue to happen. Calamities would happen. You will be tested. You will be thrown curved balls. But what is important to learn, to be able to learn and cope with situations rather than kind of get overwhelmed. And this is kind of a tip I thought was really nice. Anyhow, if you talk about meditation, breathing is very important, because whenever we are depressed or anxious, we start taking very shallow breaths. And this is almost breath of life. The more deep breaths you take, you will see a calming of impact on the whole mind and on your whole body. So break habits that no more serve you. Remember things you are grateful for. Huge, huge importance of gratitude. Ease your body, ease your mind, allow yourself to slow down. If you need to take mental health breaks and mental health break day, please do so. Take a moment to sit down and relax. Seek out things, especially right now in COVID-19, seek out things that help you improve your mood. Make health a priority, and that means your mental and physical health. Exercise is important, eating in moderation, eating healthy, and regular sleep. Sleep. Regular sleep hours are hugely contribute to your mental wellness. And we have already talked about exercise. So again, breathe, and please don't hesitate to reach out. A simple way to know what is simple depression versus clinical depression. A simple question: over the last 2 weeks, have you been more sad than happy? Just sit down and calculate that. And if the number is coming higher, then there have been more days that you have been sad rather than happy, then please talk to your primary care. If you can't access a mental health provider, then talk to your primary care. But please access care. And again, one important message: no health without mental health.
It was an excellent presentation, Dr. Abbasi. Thank you. And we've gotten a lot of questions pouring in. What makes mental illness stigma so hard to change and also to study?
Because it's all hidden. That's the slide I showed you, right? When you have stigma, means that you are ashamed of something. And when you are ashamed of something, you try and hide it, right? You don't want to face it. You don't want to make it visible. So that's why it becomes harder. And stigma, then what happens is stigma and depression where makes your thinking very negative. So the more depressed you are, more chances you will think negative thoughts. You would be like, oh, something is wrong with me. I'm horrible. I'm this bad person. I can't tell my mother, my father, I can't burden them. I'm such a worthless person. So this is how the vicious cycle happens. And that's why it is very important not to isolate, because when you talk to somebody, you start to understand that these are your thoughts, these are not real, these are your negative thoughts that are in fact creating negative emotions, and those negative emotions are creating this bad behaviors then.
I agree with your point of judgment that people don't make it easy. If they keep judging you and if they just keep kicking you down when you're already down, then it's not easy. So
I truly agree there. But I think yours is an amazing generation. You guys are, you can be your own advocate. That's why I keep talking about break this cycle of stigma, shame, silence. Somewhere someone has to stand up and start breaking this up, right? Be your own advocate. One thing also is they can be judgmental, but they are not living in your circumstances. They are not living in your body. They are not living in your mind. So you need to focus on your being well. You doing well should be important for your sake, not for anyone else, right? Your sake, and your God wants you to live your optimum life, your best life. And for every negative, try and find something positive. In a family that's very judgmental, I'm sure there is one sibling, one aunt, someone that can provide that support.
so you mentioned unhealthy coping mechanisms. How do you cope with the stigma of mental illness?
So unhealthy behaviors is that if I'm not going to seek care for my depression, what am I going to do? I'm either going to eat excessively or stop eating. I will either sleep whole day or not sleep. I will smoke. I will drink. I would like to party because, you know, your good mood hormone, dopamine, in your reward system is not there. So you are always seeking things to increase that dopamine in your head. And that's where substance abuse comes in. Or you must have be familiar, cutting. Some people start cutting themselves because it gives them that high dopamine, because when you cut your body, your brain sends lots of dopamine and serotonin to dump the pain. And that's where people feel like, oh, if I cut, I feel good. So people start cutting themselves or try to hurt themselves. People start boxing, and you know there is so many things they can indulge in that can be detrimental. So how do you see it? Visibility. Stand up. If you are suffering, then you access care. If someone around you needs help, then you be that safe space for someone else. So that's how we are going to break this chain of silence and shame. We have to stand up and start talking about it, having these community conversations. Judgment is also two ways. We have to check our own behaviors and attitudes. Are you encouraging to people? Are you able to be able to the safe space for your friends, your siblings, your loved ones? Can somebody come to you and say, hey, I drank last night. Would you be understanding and understand what's the reasoning behind it instead of judging them immediately? So it's going to take each one of us to do our role.
So there's two questions and they're interrelated, so I'm just going to combine them into one. Is mental health stigma decreasing, and how can we reduce discrimination and stigma? So do you think that the curve is generally going down? And if not, how do you propose we should reduce it?
So one thing, definitely, I've been working in the field of Muslim mental health for 15 years now. And mashallah, I've seen a huge growth in a lot of organizations that are coming forward: Family Youth Institute, Institute of Muslim Mental Health, Nasiha, Rahma. I mean, there's so much amazing work being done right now that I do think that at least we are moving away from that initial absolute darkness. There is more glimmer, more light coming in. So I can say we have a huge way to go, but at least we are moving in right direction as a community. But I think South Asian community is worse still. Like today, I was just listening to the divorce rate presentation, and just a small thing that getting your kids married to somebody who has had a divorce. So there's this stigma again of judging people, so we really need to work as a community on these issues.
Can stress create grandeur or narcissist behavior in someone? And how do you tell the difference between the two?
So grandiosity, it can be a symptom of bipolar manic episode. Grandiosity means thinking like you are the best. So if it is part of a mood spectrum, like a bipolar manic episode, then it's more like a disease thing. But narcissistic and grandiosity is a personality disorder. Personality disorders happen when over a period of time you have developed certain defense mechanisms which are not mature. So the mature defense mechanisms are that understanding that, okay, this thing happened, somebody said something, but it was not about me, it was about them. Having maturity and understanding, being able to laugh at things. Immature is like when you start thinking like, oh, everybody's out to get me. This person made this remark about me. So narcissistic personality disorder, when they have grandiosity, they have no empathy. They really feel everybody around them don't count, don't matter. Everything is about them. It is very different. And narcissism as a personality disorder, they don't have self-awareness about their behavior, and it's very hard to be with them. At least with bipolar manics, once the episode ends, they have some insight into their behavior, and it is treatable with meds. With the personality disorder, unless you are aware and very adamant to get treatment and be in a long-term therapy, it is very hard to break those cycles.
Thank you. So there's another question. In your practice, do you use alternative treatments such as acupuncture or cupping, hijama, and have you seen any efficacy in these treatments?
Culturally, yes, I've seen a lot of those things happening. And I say, to me, anything that relieves your stress, I will never count it out. If it's healthy coping, of course, I won't recommend you going and drinking and partying, but anything that's healthy and within healthy parameters, if it's yoga, if it is meditation, if it's cupping, if it's massage, whatever makes your muscle and your body relax, I'm okay with that. I do recommend, if you have a belief in that cultural practice and it relieves your stress, I support it. Place it with the medication. So I kind of sometimes have to bargain with my patients because they want to take natural supplements and they are always like, why should I take a Prozac when I can take St. John's wort or some turmeric milk? So you negotiate. If it's turmeric milk, I recommend it. Like, okay, at night drink that, but take your medication. So remember one thing, this myth that psychiatrists are all about prescribing meds. We do not right away jump to meds. Meds just come in like in case of diabetes, like, unless it's diet control or exercise control, don't prescribe meds. You only prescribe when you think it has gotten to a point that a medication is needed. So what we can safely allow without interacting with our medication or without interacting with your safety, we would allow that.
And next question, what is your take on medical marijuana for these types of illnesses from an Islamic and medical perspective?
I do not believe in medical marijuana. That said and done, it does CBD oil. We are seeing a lot of benefit in pain and in PTSD, but in itself, marijuana has two components, which is CBD and then THC. So the CBD is the component now that is available, and some psychiatrists are using this. And when it comes to THC, that's where the addiction part, the high part, the mentally altering part comes in. Then that's the piece that concerns me. CBD oil is being used. Some psychiatrists are using it. I personally have not prescribed it. And religiously or Islamically, I don't think there's room for that, but you will have to ask an imam more.
So Dr. Umber Khan joined us a bit late. She was busy, but Dr. Umber, would you like to add on to this any of your own statistics or points?
Assalamu alaikum. Jazakallah khair, Dr. Abbasi, for your wonderful talk. It was very insightful, something that is very beneficial and much needed for our community. I thank you again so much. And we will, for those who have been asking, this session is being recorded and we will post it on our website. I'm sure that this is a topic that many of us would like to revisit in the future. So we would love to have you back, Dr. Abbasi, for
Thank you.
another talk, inshallah. I think I just wanted to add one last question, which is for our community, the Muslim community, is how is we as physicians, how can we be advocates for, regardless of our specialty, how can we be advocates for promoting mental health within our community from a medical standpoint?
You know, I'll share with you a very scary statistics that it's like a one physician completing suicide every day in America, something like that. And when we saw how many of them are accessing mental health care, the number is the lowest. So it's a tragedy that being a physician, we tend to neglect our own mental health. And if we are not acknowledging our own mental health, of course, then we get so fixated on physical symptoms that then you are not encouraging or having these discussions with your patient. I think it is extremely important, whatever specialty you are working in, that to talk about stress, to talk about coping skills, to do a simple PHQ-9 screening in your clinics. Because in the end, most of the other practices see our patients, mostly they are going to see depression and anxiety. Then it's only severe cases that make it to mental health providers. Given the shortage of psychiatrists, I think, again, the judgmental piece, having our own biases around mental illnesses, we will really have to work on that. And I think everything starts with you, yourself. Being a physician, you need to be very cognizant of your mental health, mental well-being, and of each of your patients.
There was a question in regards to a pharmacological question. Is your personal position or interest on ketamine or psilocybin in regards to depression or any other psychological ailment?
I am more familiar with ketamine because that has been in use and there is more literature and research coming out on ketamine, but they have not been able to turn it into a capsule. So the ketamine was being used with ECT as an anesthesia. It's a short-acting anesthesia, right? So what we were seeing that in ECT, when you give general anesthesia, if you give ketamine, then the people were feeling less depressive symptoms after ECT. But when they tried to do it in a pill form, we don't have very substantive results right now. So that's ongoing work. So hallucinogens are being used more so with PTSD, but again, it's a new experiment, new research. So I tend to not go on experimental things. I first try and stick to the FDA approved ones. Sometimes you kind of mix one or two together to have that result. But again, there is all that work. So it's $1 billion industry, but honestly, we still are very behind the pharmacology. And I think that again talks about the structural stigma against mental illnesses.
And I think from an Islamic point of view, prescribing hallucinogens is not moral or ethical in any way because altering sensations or consciousness.
So, it's a fine line. If you see, although we avoid pork-based medication, but it's about saving a life. And there is always exceptions in Quran. Quran also gives you that exception if it's about saving a life. And I might be out of my place, and you can ask an imam, but that's my understanding. Because if you see when it talks about pork, it says that if you are starving or dying or something, you can. But so medicinal does change. If it is for medicinal purpose, and if we see with the medicinal marijuana, honestly, or medicinal CBD, if it is life-saving, or if we see enough research, I do think then there might be some flexibility because it's for saving a life. Right?
Yeah, provided there's no alternative, preserving life always takes priority.
Correct. Exactly.
All right, well, thank you so much. It was excellent, and I'm sure that everyone found this very useful. And we're so happy that you came and you delivered this for us. Thank you so much, Dr. Abbasi.
Thank you, Mariam, for attending Muslim Mental Health Conference and initiating this. Thank you.
Really enjoyed it. Thank you.
Thank you, Amber, and everyone. Thank you.
Thank you very much, Dr. Abbasi. We look forward to having you again in the future, inshallah, if you would allow us to. Jazakallah khair.
Absolutely. Take care.
Assalamu alaikum.
Wa alaikum salam. Wa alaikum salam.